Number 10, immune checkpoint inhibitors for brain cancer. Glioblastoma multiforme, or GBM, is an aggressive malignant brain tumor involving glial cells of the brain. These cells, which provide support and protection for neurons, are the most abundant cells within the CNS. Glial tumors, which are also called gliomas or astrocytomas, develop when glial cells become malignant and grow rapidly. GBM now accounts for nearly 50% of all gliomas and approximately 15% of all brain tumors. There are an estimated 240,000 cases of brain and nervous system tumors per year. GBM is the most common and the most lethal of these tumors. There have been few significant therapeutic advances in the field over the last 2 decades, and innovative treatment strategies are desperately needed for GBM. One of the most exciting approaches involves immunotherapy with checkpoint inhibitors, the intravenous drugs that block the proteins that cancer cells use to disarm an immune system. Interest in using the body's immune system in the war on cancer has been heightened by the remarkable results achieved by several FDA-approved immune checkpoint inhibitors, and there are others in the drug development pipeline. It's these intravenous immunomodulators that effectively block the action of PDI and other proteins that act as brakes or checkpoints that cancer cells use to escape recognition. Once fixed or freed by special checkpoint inhibitors and with the natural defense mechanisms back on, this permits certain white cells of the immune system, the killer T cells most notably, to carry out their lethal attacks on marauding cancer cells. While immunotherapy with checkpoint inhibitors does not currently offer a brain cancer remission or cure, it's still the early days in their development. The potential of these drugs, given alone or in combination with existing therapies, is enormous.
So luckily we have a card-carrying immunologist with us, Dr. Neil Hacohen, who can answer this very simple question, which is, how close are we? What's the timeline? How close are we to realizing the benefits of using checkpoint inhibitors for treating, for example, glioblastoma?
Yeah, so first of all, you should know that these therapies are being tested now in an enormous number of cancers across the world. So there are hundreds and hundreds of trials, including for glioblastoma. What evidence that we do have that's interesting that it is likely to work for glioblastoma is that metastatic melanoma that goes into the brain is treated quite well with these therapeutics. They work for metastatic melanoma, advanced metastatic melanoma, which is something that couldn't be cured very well before. And now you're getting a certain percentage of people, quite reasonable, between 20 to 40% of people actually having durable responses, which is something that one doesn't usually see. And so essentially any tumor that goes into the brain, there's a potential for this drug to work for a certain subset of people, not for everyone. And glioblastoma among these is a tumor where your body already has an immune response against the tumor spontaneously. And what these checkpoint blockade inhibitors, when you give them, do is they raise that response so that it's more likely that the immune system will destroy it.
Would they be used in combination with other therapies, like radiation therapy?
Yeah, so one of the things that the immune system needs is pieces of the tumor to react to. And what radiation therapy and other therapies will do is destroy cells, release material. The immune system can then see that material, be trained on it, and then continue the attack. So yes, I think it will be something that will take many clinical trials to figure out, but the preclinical work certainly suggests that the combinations will be very important.
And just quickly, any other neurological disorders beyond glioblastoma? Do you see checkpoint inhibitors being used?
Well, I mean, I think that inducing immunity in the brain is not necessarily the thing you want to do most of the time, but I think potentially for chronic viruses, that could be something that in the future will be an interesting direction.
Excellent. Thank you.